Good morning, everyone. Am I audible to you all? Okay, Tina, thank you very much for that. So, once again, good morning to everyone. My name is Varghese, and I am the one of the trainers in IRS Group who trains with OET. Okay, so I do see a couple of new names popped up today in the attendees. So, for the newcomers, I would like to tell you that in this webinar, you would have or you would get the chances of asking questions. With regards to that, you can use the chat code, which is onto your right hand side. You can pop in your questions there, and I would try to answer all the questions which appears on the chat code. Okay. With regards to this, another thing I would like to recommend is that it would be really advisable if you have a laptop or a desktop, it would be really recommended that if you could use those for the session or the webinar sessions, because um, the the network reception on the mobile phones might be at times could be feeble, and there could be some disruptions while you are um, attending the webinar. So to make any, to avoid any further inconvenience with regards to the webinar sessions, I would really recommend if you could use a laptop or a desktop. So that is depending upon you. There is no harm in using a mobile phone, absolutely fine, but there are some things, or at times you might feeble out from the reception. Okay, good morning, everyone. So today again, as per the request of quite a few of the candidates, I will be carrying on with the speaking module just one more day. So that is just for today. So today, I hope we would be able, or you would be able to get all your doubts and questions with regards to speaking, and you will be able to perform a very good practice session with regards to your speaking. Okay, so let me tell you what I am going to do today. Just a quick reminder, or just a quick recap of the criteria which we have discussed on the past 2 days or past two sessions, to just give you a reminder or to just remember all the criteria. So if you have those criteria in your mind, it would be quite easy, or it would be quite beneficial when you're doing your practices. And when you practice with those criteria in your mind, you would be able to perform well in your exam or the test day with regards to your speaking. Okay, so let me just quickly let's quickly go through. Let me give you a few questions for you. So let me see if you could answer those questions with regards to the criteria. So when you talked about the different criteria, it has been classified into two. Could someone tell me which are the two criteria which has been classified as per OET? You can put any comments on the chat code so that I could view them. Yes, but that's absolutely right. The linguistic and clinical communication. Yes, I hope everybody is very clear about these two categories or these two um, criteria which OET is following with regards to, or how are you being assessed in your OET speaking test. Yes, that's absolutely right. And we have different classifications in our in each. There are two criteria, that is linguistic criteria and the clinical communication criteria. So I think um, the main focus which we are going to do out here today is with regards to the clinical communication skills, how to develop them, and what are the clinical communication which you require while you do your during your career as well as for the test day. So whatever you have, whatever you acquire during your practice with OET, by practicing OET, definitely this would really going to help you in your future career as well. So I would really suggest or say that try to practice as much as you can with these clinical communication skills, because when you're going into I know most of you will be having a dream of moving into English speaking environment or English speaking country. So out there, this is very essential. That is why OET has put this criteria, and that's why they do assess your skills with regards to these criteria. So, okay, so whatever you learn at this point of time, or whatever skills you acquire during the OET test preparation, should stand or should be there with you for your entire career as a medical professional, which would be really helpful. Okay, so let me just tell you what are we going to do today. Today we are going to first, go through, as I said, to just quickly recap the criterias. I'm not going in deep, just putting you the or providing you with the criteria. I will not be explaining that too much. If you have any queries during our sessions with regards to the criteria, please pop up your questions on the chat board. And after that, we would be watching, I'll be letting you watch a video with regards to the communication skills. As we have did last day, we viewed a video. It's almost a similar type of video, wherein you can see the different communication skills which has been used while speaking. So I want you to really concentrate and monitor very closely on those things. And if you would like to take notes, please do so, and try to practice the same while you are doing your practices. So I wouldn't really say that you should practice the same words or same sentence or same the pattern. The pattern could be the same, but not the same words and not the same sentences. Okay, so what you need to do is you need to create your own sentence or your own sentence construction depending upon the situation. So don't try to mug up what is being said on those um, videos. So just try to understand what should you be doing while you do your speaking test or while you're doing your speaking practice, so that you could improvise on your speaking. Okay, so let's quickly go through the criteria once again in the beginning. So let me just bring up the criteria for you. Okay. Okay, here we are. Okay, so as we have discussed, that we have two criteria, that is the linguistic criteria and the clinical communication criteria for the OET assessment of speaking. Okay, so in the linguistic criteria, we have intelligibility, fluency, appropriateness of language, resources of grammar and expression. I hope you all know what is all these criteria stands for, and what does this assess, or what does OET assess with regards to these criteria. So I hope you all know this. Um, does anyone have any questions pertaining to these The first criteria, that is the linguistic criteria, that is intelligibility, fluency, appropriateness of language, resources of grammar and expression. Do you have any sort of questions with regards to these four criteria under linguistic criteria? I hope everybody can hear me, and I'm quite audible to you, and also the video is also quite clear. Okay, clear, clear, clear. Okay. Do you have any questions pertaining to the linguistic criteria? So that is pertaining to the linguistic criteria. We have four. That is intelligibility, fluency, appropriateness of language, and resources of grammar and expression. Okay. Yes. Quickly, Merlin, I would just quickly summarize what is the linguistic criteria. So, as we say, we have four in place. That is intelligibility, fluency, appropriateness, language, and resources of grammar and expression. So, talking about the first criteria, the intelligibility, this is where your pronunciation, your stress, intonation, rhythm, everything comes into play. So, uh, the the criteria, the intelligibility, is mainly focusing on whether you are very easily understood to the listener or not. So, for that, you need to be quite clear, audible. You need to use stresses, intonations, and you need to have a rhythm while you're speaking so that the listener does not have any strain understanding you or listening to you. So the listener should not have any sort of strain to understand you or to understand your language, what you're speaking. So this is what intelligibility is. So to make the listener understand, your pronunciation should be correct, your stress or your the sentence formation you put in a sentence, you use the right stress, intonation, the modulation, I mean to say, modulation of your voice, and the rhythm. Okay, there should be a good rhythm while you're speaking rather than having breakages while you're speaking, or you have a monotonous way of speaking. That wouldn't be quite good. You need to have a very good rhythm while you're speaking. So these are to concise or to summarize intelligibility. This is what it's all about. I hope, Marilyn, you understood what I really meant from intelligibility. Okay, thank you very much, Marilyn. And we move on to the second criteria, that is fluency. So fluency means to maintain a pace while you're speaking. Okay, you need to have a pace, a speed, or a pattern when you're speaking. So normally it has to be normal so that the listener understands you, or your words or your signs reaches the listener very clearly. Okay, it depends upon each factor. For example, when you're speaking to a teenager, you can try to maintain the same pace as in a teenager. For example, most of the times the teenager is quite fast while speaking. So you also need to cope up with that same speed, or you need to maintain that pace. But when you speak with an elderly person, definitely it is quite difficult for them to understand. Even they could have, or they might have some sort of in real scenarios. I mean to say, in real scenarios, okay, in real scenarios, they might have some sort of um, hearing difficulty. So you need to speak up a bit more louder, or you need to speak up a bit more slower so that they could understand. Okay, so you need to maintain a pace which is quite easy for the an elderly person to understand. So that is what a fluency is all about, and also not having any sort of breakage while you're speaking. Okay, I'm not saying that fluency doesn't mean that you go or you do your speaking in in a stretch. No, you need to use certain pauses. You need to use certain stops or at times to so that the other person understands you very clearly. And again, um, to avoid any repetitions that would make the listener very boring, or the listener could be quite boring if you have the same words repeated again and again, and also not having any sort of uh, interruptions while you're speaking, or as if like you are hesitant occasionally while you're speaking. Occasional hesitation is fine, but it should not indicate any sort of um, signs that you are actually trying to structure a sentence, or you are trying to search for words. But all these things should be considered. You need to have a good hold of or good hang of the language so that you could speak very fluently. So some of the tips which I could suggest, for to improvise on your fluency is that the first thing is to improvise on your fluency is you need to most of the candidates what they do is that they try to think the words which they need to put in their regional language. You think in most of the candidates think in regional language and try to translate that into to English. So that is why you have hindrance in fluency, or to get with the right words or the right sentence. So I would really say that I would really recommend that you think in English itself so that it would not hinder you with your speaking. So when I say this, the people who are listening would be definitely thinking, how do I do that? Yes, definitely that is something which most of you would be having doubt about. Okay, what do you need to practice this, or to practice this thing is the best thing is while you're doing something, or speak to yourself. For example, you see something, you speak or utter the word or utter the sentence in English itself rather than translating. So by doing or by practicing that quite often, you would be able to attain fluency. For example, you see a person in a green dress. So you're not. I don't. I'm not saying that you go and speak to that person. All you have to do is like, oh, she is wearing a green dress. Okay. So as if what is in your thought that needs to be repelled. So all try that. Or you see a pencil on a table. Oh, I do see a pencil on the table. So try creating sentences and saying that, or speaking out. By doing this, you would be able to attain fluency in your speaking. Or, for example, uh, even at least even if you say that in your in your mind, if you don't want the other person to listen, we all most of the candidates have some sort of shyness to speak in English in front of the other. So that is because you doubt yourself that whether you're making a mistake or you would make a mistake or not. So you need to get out of that fear so that you could improve on your language, and you can definitely improve on your fluency. I hope this would really help you to improvise on your fluency and to speak English without any hindrance. Okay, so with that, I hope this would help you. So I would recommend most of you who is having problem with fluency, if you could do this, this would be really great. So I want all of you to try this, okay? Okay, so moving on to the third criteria, that is the appropriateness of language. Okay, what do you mean by the appropriateness of language? Using the right register, tone, and lexics for the context. For example, when you're speaking, okay, using the right word and the right sentence depending upon the situation. Okay, so that is what the appropriateness of language is all about, and also using the right register. For example, when you are speaking with a person, you can say certain things with a stress or without a stress or with a tone. For example, if you want to really imply on certain things, you need to change your tone, right? Okay, there could be one sentence could be said in different tones, so that the when you change your tone, the the understanding of the person differs depending upon the tone. The tone when you change the tone, definitely he would have a different understanding on different occasions. For example, let's say I have illustrated one of the example in the last session, like please stop. Okay, that means very polite. Okay, the next one is please stop with a higher tone or a higher register would give the person that I am quite adamant with regards to what I just said right now, or it's like an order. Yeah. So this is how you use the appropriateness of language and uses of correct words and sentences while you're speaking, so that depending upon the situation. For example, you use okay, most of the times, most of the candidates makes some errors with regards to this particular word, session. Okay, uh, what I've seen is that the session and section. Okay, these are the two words which are quite similar, but sometimes people use it in different occasions. They instead of session, they use section. Okay, okay, so you need to, what I want you to do is that go ahead and check the dictionary and see the difference between session and section. Okay, rather than when a person tells you that, definitely it would not get stuck in your mind. I want you to do it by yourself. Go ahead and check Google or check the dictionary about the meanings of two sessions and the usage of these uh, two words. Okay, most of the times when you're doing your practice or your test, there are times when you make mistakes with regards to this, the sessions and the sections. Okay, so this is just a quick example which I would like to put it across to you with regards to the appropriateness of language, the usage of the appropriate words and sentences. I hope that is also clear with you all. Okay, so let's move on to the fourth one, that is the resource of grammar and expression. Yes. So the usage of uh, the grammar and the expressions, yes, definitely we need to. Um, there are two things. That is, the usage of grammar means it also comes with the flexibility. You should be able to flexibly use different words and sentences while you're speaking, and usage of different grammatical expressions. Uh, the the first and most thing which you needs to most of the people needs to really concentrate on is the tenses. The tenses, the usage of tenses. See, that is something which could be when you use the wrong tenses, it is quite very easily noticeable. Okay, so the usage of right tenses while speaking is very necessary, especially the present tense and the past tense. Okay, It needs to be very clear, and you should use the right tenses while speaking, and also the vocabulary. Okay, rather than repeating the same words and the same sentence and again, you can use similar words and sentences while you're speaking. So that actually demonstrates your your knowledge or your vocabulary. So when I say about the usage of vocabulary, it doesn't really mean that you need to use high-end words or the tough words. Okay, all you have to do is use very simple words and sentences so that the other person understands you very clearly, but not with the same words every time. During a 5 minute speaking, try to avoid any repetition of the same words or the same sentences. Try to use different forms and ways of speaking. Okay, um, if you have to use the same sentence twice, try to reconstruct or try to change it when you're speaking. Okay, rather than using the same pattern of speaking, try to use a different way or a different sentence construction. And also, uh, you can also use idioms, okay, idiomatic speech. When you say about idioms or idiomatic speech, that is use it if you are quite confident in using it. Because if you use a wrong idiom at the wrong place, that would really end up in losing scores. Okay, so we need to use the idioms very carefully if you are planning to use it. Definitely, when you use idiomatic speech, definitely that would uh, give the examiner or give the examiner an idea that okay, you are good in using or you are good in the English. Okay, so that is what the uh, impression what you could create when you use idiomatic speech. So, what are idioms? Idioms are words or short phrases which is being used um, in your speech. For example, to use very simple things, very idiomatic speech is that. So rather than saying you know in short, you could say in a nutshell. Okay, in a nutshell, let's talk about this, or in a nutshell, this is what it is. So when you say a nutshell, that is something sort of an idiomatic speech. Okay, so these things, this is one of the example which I would like to say. So you can get these idiomatic phrases from the internet. You can try to say that and try to use it while you're speaking. That would really help to improve all your resources of grammar and expressions. Okay, so this is some of the tips which you could use. And again, you should be very flexible in your speaking. Okay, as I said, you should not limit your speaking with a certain number of grammar or sentence construction or the same way of sentence construction. Try to use compound sentences or don't make it complex. Use compound, um, sentence construction and things like that. And also, it has to be very simple as well. You should not complicate the sentences. It should be very simple so that the other person understands it. Okay. So with this, we could wrap up the criteria with regards to linguistic criteria. I hope everybody have understood about the linguistic criteria. Do you have any questions pertaining to the linguistic criteria in regards to our, speaking? Okay. People, please feel free to, ask questions. Absolutely fine, because this is a time where you get to ask a lot of questions, and I'm here to answer all your questions, whatever is, known to me. Okay, if I don't have an answer to it, definitely I can get back to you and clarify that in a later on webinar session. Absolutely fine. Okay, so any questions do you have? You can bring up any scenarios in your speaking role play cards with regards to this linguistic criteria. So absolutely fine. You may ask questions. That's when you get to clarify your speaking test, um, and to perform that very efficiently. Okay. So I hope most of you are clear with the criteria with regards to the linguistic. With that, we can I move forward to the next criteria, that is clinical communication criteria. Marin, I do see your question. Can we use medical idioms in between speaking? Um, when you say medical idioms, could you just give me an example because it is quite new to me? Could you give me a quick example, Marin? Um, it is bitter pills to swallow. Okay. When you say that, yes, you can definitely use that. There are idioms which is having medical terms in, yes, but it does not really say that it is bitter pills to swallow. Okay, when you say that idiom or when you use that particular phrase, it is not just for the medical profession alone. We can use this, but it can be used that with the other the casual talks as well, or the casual way of speaking as well. That's absolutely fine. Okay, so it is to this particular statement or idiom is not just for the medical purpose. It is also used for the casual speaking. So nothing like that. Yes, there are a lot of uh, idioms or idiom phrases or speech ways wherein where a lot of medical terms are being used. It's a bit bitter to say so. So definitely you can use those type of idioms, but you need to make sure that to use these idioms, please be quite confident in using this. So don't use at the wrong situation, okay? And don't use the idioms which are not appropriate at that particular situation. Okay. Yeah, I think it is quite clear with you, Marin. Okay. So any further questions? Anybody has any sort of questions? Okay, I hope no. So we will move on to the next criteria, that is the clinical communication criteria. Okay, this is, now we have five criteria here. So quickly summarizing this is relationship building. Okay, using the appropriate greeting, introduction, and using the respectful attitude towards while you're speaking, and using not using any sort of judgmental approach while you're speaking. Not concluding yourself, this is what he is. No, always try to adapt a non-judgmental approach while you're speaking. Okay, so don't forcefully say that you have this. No. Okay. You may say that looking at the, for example, uh, you ask a lot of questions on analysis. You see that this particular patient is having fever. Okay. Uh, so let's say, yeah, so, sorry, it was a wrong scenario. Okay, let me just quickly think about a different scenario where using a judgmental approach. Yes, okay. So if a person comes with a lot of mm, um, maybe breathing problem. Okay, he is having some sort of breathing problem, and he approaches you to do the diagnosis. Okay, asking a few questions, and you come to a conclusion that okay, it's all because you say like this. It's all because you are smoking too much. Okay, you are a chain smoker. So when you do that, you are actually using a judgmental approach. Okay, you could really say that one of the reasons uh, to your breathlessness or breathing problems could be your smoking habits or your smoking. So that is how you present yourself. And you say that if you could really consider in bringing down your smoking would definitely benefit you and to help you recover from the situation. So this is how you put forward, or it is not just that you put it in an order form. For example, you say you need to quit smoking, otherwise you would not benefit from your medication or things like that. So you could just put in request forms basically, like usage of consider that your suggestion. I suggest that this is what, or my opinion. All these things you can put it forward, okay, rather than using a judgmental approach. Okay, and also showing relationship building. In relationship, you can also show feelings or empathy feelings or emotional states. For example, a patient himself releases his emotional or emotions. You need to put up empathetic statements like oh, I really could understand what the situation you're going through, or things like that. Okay, so that is up to you. You can practice your own ways of putting in certain empathic statements. You may write down these statements and use it depending upon the situations. Okay, or that is how you can build up rapport building or relationship building while you're speaking. Okay, next, I hope this is quite clear with you, the relationship building. Do you have any doubts with pertaining to relationship building, how to do it, or anybody has any sort of questions? Um, I hope no one has any sort of questions. I don't see any comments come popping up on the chat. So let me move on to the next um, criteria in clinical communication. So that the next criteria which we have is understanding and incorporating the patient's perspective. Okay, picking up clues from the patient speaking is one of the things which you could do while you're speaking. Okay, by when he is speaking, he is saying that um, uh, due to work, I would not be able to perform this. I have a very busy schedule. Okay, the patient might say that thing when he is speaking. So when you say that he works, the patient says that okay, I start my work from morning 7 till 8 in the evening, and you are going to suggest him with the option of like let's say you needs to have homely food, or you need to have food from your home to in order to have a good balance of your diet, so which is not quite possible, right? Because he works from 7 till 8. So you need to pick up clues from his stating that if you give an option like that, definitely that wouldn't be right. So what you could say that I understand that you have a busy schedule of work that is from 7 to 8. One of the options which I wanted to recommend to you was this, to have a homely food or taking homely food or to come to home and to have food. So you can put in something like that. If it's good that if you could take with you a tiffin or from your home so that you could avoid any sort of junk food and things like that. So you are actually picking up some sort of clues from the patient while he is speaking, or he is saying that the patient would be saying things like, okay, uh, I have a habit of cycling. Okay, so you wanted to, I go for cycling every week and on a Saturday for 2 hours. So this is some sort of an exercise which you want to actually give. So you could say that, yes, I do see that you have a routine of cycling on every Saturdays. Keep up doing the good job about the same so that you maintain your exercise. So this is something which, this is how you pick up clues. So I'm just saying certain things which, or certain scenarios which, or certain speaking or picking up clues from the patients. So that is up to you how attentive you are when you are, speaking, or when you're doing your mock sessions, or when you're doing a test. So you need to be quite attentive to pick up these clues from the patient. Okay, and also explaining or relating explanation to the elicited ideas of the patients. For example, the patient gives you some sort of an idea. Maybe you can transform that into your, or you can club that with your option or opinion or suggestion. Okay, so he says that the patient says that I'm a vegetarian. Okay, so when you give options, or when you say that, okay, this is the best time, since you're a vegetarian, that is really good. That a lot of vegetable leaves or leaves would really help you in this dietary regimen, and there are a lot of vitamins which you could gain from being a vegetarian. So you try to combine something or some ideas what the patient or the person whom you spoke to gives you. Okay, this is how you process, or you meet the criteria of understanding and incorporating with the patient's perspective. Okay, I hope this is very clear with you. Any doubts pertaining to this? Anyone of you is having any sort of doubt? Clear. Okay. Okay, so with that we move on to the providing structure. Yes, while you're speaking, see, when we speak, we always require a sort of structuring while you're speaking. So you need to illustrate what are you going to do while you are speaking. Okay, tell that what are you going to do first, what are you going to do second, what are you going to do the last. Okay, so maybe the patient would be having quite a few concerns, maybe one, two, three. When you have, the patient would be having a concern with regards to his sleeping. He would have a concern with his dietary regimens. He would have his concern with his exercise regimens. So basically three things. Okay, so you need to, when you find that out, you need to structure yourself. What are you going to discuss with the patient first, for example? Or the patient comes on this, in this scenario which I just mentioned to you. You could state with, okay, you have this. We would talk about the the diet. The first we will discuss about the dietary regimens. We talk about the secondly we will talk about the exercise regimens. We talk about your pain or whatever it is. Okay, so you need to structure, or you need to tell the patient that this is how you are going to structure your speaking. And also you need to use signposting while moving on from one point to another. For example, as I said, we use you say a structure that, okay, you're going to speak about dietary regimens first. The second is about the exercising regimens. Okay, so once you finish with your dietary regimens, you when you before you move on to the exercise regimen, you need to show some sort of signposting. Okay, we let's move on to the exercising regimens right now. So this is a signposting stating that, or making the patient ready for the next discussion which you're going to conduct, or the next thing which you're going to say. So this is what sequencing yourself, or and when you're doing the sequencing, please make sure that you do it very logically. Okay, when you say about when I say about logicality or logical way of constructing or structuring in this your speaking is all about, okay, rather than saying what you need to do at the end, it should not be said in the beginning. Okay, for example, uh, let's say the patient comes in for dressing. Okay, you start with the dressing formalities, or you say that, okay, we would do the dressing first. Oh, I'm sorry, that we need to do the medicine first before your dressing. So you should not have that type of errors while you're speaking. So that is why you need to have a logical way of structuring your speaking. So basically, you need to say that, okay, we would, what you're going to do is first clean the wound with whatever it is, with you know some sort of medicine or whatever it is. Okay, once you do the cleansing, you go with the application of ointment or some sort of medicines towards the wound. Then you wrap the wound with the dressing. Okay, so this is a logical way of saying a thing. So you say that in an order. Okay, so and it has to be logically there. So this is what this is all about providing a structure while you're speaking. Okay, I hope that is quite clear with you. Do you have any sort of questions with regards to the indicators providing structure? Anyone? Anyone has any sort of? Okay, very clear. Okay. No, no. Okay. So moving on to the fourth one, that is information gathering. Yes. Uh, you know, for information gathering, facilitation, there are different things. So when you're gathering information, you need to be the first thing you need to have is you need to have a good listening skill. Okay, you need to be an active listener. You need to listen to the patient very clearly with minimal interruption. Okay, you should not interrupt while he or she is speaking. You should be patient enough to listen to the patient, and just simply sitting there and listening does not prove that you are listening, because you also need to put some statements, or you need to show some sort of active listening technique, or active listening prompting, like saying, okay, okay, I really understand. Okay, that is really great. Okay, so all these things, you put very simple words in between while he or she is speaking to you, so that the speaker also understands that you are listening to him and understanding what he or she is saying, or maybe asking a question while he is speaking. So, could you further explain me about that, please? Mm, okay, or asking a question pertaining to what he is speaking about. So, with minimal interruption. Okay, so that is some sort of information gathering. You're trying to understand what he or she is saying, and using open-ended questions while you're when you start with your conversation. Try to start with open-ended questions. When you're coming towards the end, try to move on to close-ended questions. I've discussed about what is an open-ended question and a close-ended question. An open-ended question is the answer should not be anything like yes or no. Okay, it should be an elaborate one. He or the patient has to give, an answer in a sentence or two. Okay, or a closed-ended question is something which states that yeah, yes or no. Okay, so that is what about information gathering. And moving on to information. This is about information gathering, and clarifying the statement which is vague when you need application. For example, when a person speaks to you and it is not very clear, or you're not clear with the word or the sentence he or she has said, you can definitely imply, or you can ask whether to get a clarification on that. Okay, so and also summarizing the information to encourage correctiveness. or correction. Okay, you can quickly summarize so that information gathering is very prominent. So you demonstrate that whatever information you have gathered is right or wrong. So that way you can illustrate that to the speaker or to your patient. Okay, so I hope that is very clear. The information gathered is clear to everyone. With that, we will move to information giving. Okay, when you actually give information, try to check what the patient, before you start with the information giving, try to understand or try to know what does the patient know about the information which you're going to give. Okay, or is he ready to receive this information? Asking permission, if with regards to this. So, is he ready to accept your information? If he's not ready, what is the point in giving them? Yeah. So you need to get the permission before give the information. Or when you say about permissions, you need to take permission when you ask quite a lot of questions. Okay, you need to take them, or you need to take permission for discussing certain things with him. Ask him if he is, or him or her, that if he is acceptable, or if he is ready to accept, or if he is ready to discuss this thing today with you. Okay, so all these things would be necessary. So when you give information, make sure that he is ready to accept it. And when you're giving a lot of information, make sure that you have certain pauses periodically, so that the patient and try to see if the patient is understanding what you're saying. Okay, in a periodical ways, maybe asking a quick question: are you able to understand me? Are you able to catch up with me? Or do you have any further questions? Do you have any questions until now? So all these things would demonstrate whether the information given is being perfectly or completely taken by the patient. Okay, when you finish with the information, it is also very necessary that if you could check with the patient whether he or she is having a good understanding about what you have given, what all information you have given. Okay, so maybe trying to ask him to summarize, him or her to summarize about the discussion which you had went through today. Okay, so and also in during after your information given, you could try to discover about if the patient needs any further information with regards to this. You can check. So this is how you give more information. Okay, so I hope everybody is clear with all the criteria of our speaking. Any questions with regards to the criterias? No. Okay. Okay, with that, we would move on to an video with an audio with regards to the speaking. It's a 10-minute audio. Okay, so please listen very carefully and see how the the medical professional um, gets the information, uses a word. This particular video is pertaining to the clinical communication criteria. So how he uses signposting and things like that. Okay, so listen very carefully and try to pick the criteria, or try to identify the criteria from the speaking. Okay, so let me play that for you.
Oh, hello there. It's Mrs. Dawes, is that right?
Yeah.
Ah, good.
Yeah.
I'm Dr. David. How can I help you today?
I'm sorry, I might be wasting your time a bit, but I've come because I'm not sleeping very well. I'm just exhausted. I just wondered if you could give me anything to help me sleep, some sleeping tablets.
Okay. it would really help me if I could ask a few more questions about how you're feeling and some of your symptoms, and then we can sort of see how I can help you. Would that be okay?
Yeah, that's fine, thank you. Yes. Yeah.
So why don't you tell me a bit more about what's brought you here today?
About a year ago, my husband was split up, and since then I've just not been coping very much.
I'm sorry to hear that.
I'm just tired all the time, and the kids and job, and I just don't feel like managing very well. I can't sleep.
Okay, well, why don't we just look at one of those things at a time? Tell me a bit more about, you say, having trouble sleeping.
I lie awake at night. I don't know what time it is, but it just seems to go on and on and on the night. No, I must have got sleep, but in the morning I just feel so dreadful.
Okay, and are you having problems with your appetite?
Yeah, I make the kids the dinner, but I just can't be bothered. I'm not bothered at all about it. Right.
And what about sort of life in general? Have you kind of lost your get up and go?
Sorry, I don't understand.
You get up and go, your energy levels, have you found that they're kind of low?
Yeah, I used to enjoy going swimming with the kids and stuff, but I just want to be on my own. I just can't be bothered. I'm just not being a very good mum at the moment as well. So I'm just so exhausted, really.
Can you just going back to your sleep? Can you tell me a bit more about that? How much sleep are you getting each night? I lie awake and just think about him and her together, things that we used to do, and I just wake up exhausted. Sounds like your lack of energy and lack of sleep and lack of appetite. It seems to me that things seem to be really getting you down.
I'm just such a mess at the moment. I'm just not coping, I'm just exhausted.
You say you're a mess?
Well, look at me. I just need some sleep.
Okay. It would be helpful for me just to sort of find out a bit more about home life and work life and ask a few questions in that area. Would that be okay?
Yeah, it's fine, sorry, yeah.
So do you work?
I work in a job centre. Gets a bit stressful at times. We've got to see so many people. Of course, they're stressed.
I've got some patients who work in the same environment. It's very high pressure, isn't it?
Yeah. Some mornings I just can't be bothered to get out of bed, and it's that's worrying me because I phone in sick, and it's not good to have a sick record, is it? It's not like me.
And who else is at home with you?
I've got 2 kids. One girl, one boy. Well, Richard, he's the youngest, he's 7. And Marie, she's 9.
Do they get to see their father much?
No, he can't be bothered now. He's got a new family. He doesn't see them at all. They're very good kids.
That must be quite hard on both you and them.
I try and be a good mum, but it's just very difficult.
Do you get any help or support from anyone else?
Oh, my mum, she's wonderful, but she has arthritis, and so she does what she can.
Does she live locally?
Yeah, she's just round the corner, and she picks the kids up from school, and she's an angel. She helps me lots.
What about you? What about your hobbies and things you enjoy doing?
I used to enjoy going to the cinema with my friends. Even line dancing, we used to go down to the village hall line dancing. But that's been a while ago. Nobody wants a bit of misery around, do they? And I'd rather be on my own now. Yeah. Thank you.
Well, I know you're not a doctor, but you must have had thoughts about what's causing all these feelings. Had you thought about those type of things?
I guess I was on automatic pilot when he first left. I guess that's why I'm in the state I am now. I don't know. Could I resent the kids? I don't know, but I suppose that's why I keep going down, and I just feel everything's useless. I can't sleep, you know.
What tends to bother you the most? Is it the sleep, or your appetite, or the energy, or
It's the sleep.
not coping with the kids?
It's the sleep. I just feel if I had a bit more energy, if I could just have something just to, you know, help me out with them so I can do the normal things.
That was going to be really what I was going to ask next. I mean, what were your thoughts about how he could help you today?
Well, I just thought with I know there's other things, but sleeping tablets, I thought they might help.
Would it be a good idea, perhaps, if we think about all the options and available to you, and then decide which ones may be best for you?
Okay. What are the other options?
Well, you might have heard of some of the talking therapies, being able to sit down and talk with a sort of a trained counsellor about your feelings and about what's been happening.
Will that help my sleep? Will that make me be able to cope the next day through sleep?
It may help you deal with some of your feelings. I take on board about the thought about using a sleeping tablet. I think that could be another option. Obviously, one of the concerns we have is that we don't want to have you on sleeping tablets for a long period of time, because there are issues about becoming dependent on them and reliant on them.
Yeah.
But we can use them for a short period of time, say for a week, to help you get back into a bit more of a normal sleep pattern.
Yeah. That sounds good, but
I mean, what about those? The two options. There's the option of the counsellor, or perhaps trying
my
a
friend,
short course of sleeping.
She had counselling. I just feel if I had some sleeping tablets, that might just give me a spur, really, and I'm quite happy with the counselling as well.
Okay, so you'd like to try both. I think that sounds a good idea. And would you be happy to see the counsellor here at the surgery?
Yes, that'd be fine.
Okay, so I can organise that. I can speak to her and ask her to contact you to make an appointment.
Okay.
It'd also be really helpful for me as well if you could complete one of our HADS questionnaires.
What's a HADS? What's HADS questionnaire?
Sorry, it's a short questionnaire, just asking some questions about your feelings, and it'll help me to find out if there's any more help I can give you when I next see you. Is that okay?
Yeah. No.
From what you've told me today, I mean, it sounds really, for the last 12 months or so, you've felt really low since you split from your husband.
Yeah.
And your sleep's not been good. Your appetite's not been good.
I'm a mess.
It sounds to me like your self-esteem's taken a real knock, hasn't it? I certainly think the help we can give you with some counselling, in which we have a counsellor that comes here in the surgery, that will be, I think, will be a benefit to you. And then we'll try this short course of sleeping tablets to try and get you back into a sleep pattern.
Okay.
And then maybe I can see you in about 2-3 weeks' time. And I don't want you to think that you have to sort of manage all this by yourself. I mean, that's why we're here. We're here to help and support you further.
Yeah, okay.
Let me do the prescription then.
Thank you.
It's 12 Hadfield Close.
Yes,
is that
it
right?
is, yeah.
Okay, so that's gone to reception now, so you can pick that up on the way out.
Okay.
And if I give you one of the HADS questionnaires as well, you
Okay.
can complete that before we see you next time.
Okay, thank you, Doctor. Thank you for that.
Okay,
Thank
see you
you.
next time.
Thank you.
Okay, bye-bye.
I hope you all were clear with the video and the audio. So after viewing the video, were you able to pick up some sort of criterias which we have discussed in the two criterias? Were you able to pick up those criterias and notice those criterias there? Okay. Do you have any questions, or does anyone feel like listening to the video once again? If you would like, I can play that once again and see on different options. For example, we can, if you would like, we can discuss about those videos and things which was being used, or the the different forms of or ways or the criteria which has been used in this particular video. Would you like to do that? If not, we will go with another um, role play card. It's up to you. Okay, Lenu says yes, please. Okay. Okay, what else we can say? Okay, Vipin says a role play card. I have a few requests with regards to the video, which mm, to discuss about the video and see what all things have been, been played on the video. So I think uh, we'll go one by one. Okay, Vipin, I think we need to address the other members' request as well. So, okay. So let's quickly view the video again and take one by one.
I'm just.
Oh, hello there. Is it Mrs. Dawes, is that right?
Yeah.
Ah, good.
Yeah.
I'm Dr. David. How can I help you today?
Okay, what I want to say in the beginning itself, did you see them how the doctor introduced himself? Okay, and how it was being placed. It was not like I'm not one of the doctor. It didn't state that I'm one of the doctor here, and so. It just said very simple, made it very simple, and said I'm the doctor. Okay, and to the name, and also definitely asked whether uh, the person sitting or the patient in sitting in front of him is the right patient or not. Okay, and asked what brings her here today, or a quick question. That was what was being placed. Okay, so let's look further.
I'm sorry, I might be wasting your time a bit, but I've come because I'm not sleeping very well. I'm just exhausted. I just wondered if you could give me anything to help me sleep, some sleeping tablets.
Okay. It would really help me if I could ask a few more questions about how you're feeling and some of your symptoms, and then we can sort of see how I can help you. Would that be okay?
Yeah, that's fine, thank you.
Yes. Here, after she or she he or she has already um, gave the purpose of her visit. Um, the the doctor did not have a clear picture of what she is really for. So he popped up with he had quite a few questions. He required clarification. Yes, as per the our criteria. Yes, he used further questioning. He wanted to use further questioning for clarification. Before that, what he did is like he did ask, uh, a permission because to ask more questions. Yes, and she gave the permission to do so. Okay, so some of the times it is, and it is very necessary that you take the permission before you ask a few questions. Okay, if it's just for one question, it's fine. But if you're going to ask a series of questions, yes, definitely you need to get the permission of the person and to further proceed. Okay, so that needs to be there. Um, so let's move on with the video
I
then.
think, yes. Yeah.
So why don't you tell me a bit more about what's brought you here today?
About a year ago, my husband was split up, and since then I've just not been coping very much.
I'm sorry to hear that.
I'm just
Okay, so here is what the empathy factor comes into play. Okay, and I don't know if you would really notice this. Okay, the way of presenting things, or the doctor. Okay, the doctor's tone of voice was not so loud. He was, his register thing, everything, his pace, everything was quite low. Okay, this is how you do your speaking. For example, okay, he tried to adapt the same pace, the same tone, the same register of the patient, because the patient is in real agony and she has a lot of problems. Okay, so he tried to uh, adapt the same. This is what you should be doing when you're doing your speaking or your testing. So depending upon each situation, you need to cope up with the register, the tone, or the even the sound or the pace. All these things needs to be there. So you need to have pauses while speaking. Even when he was applying the empathy towards it, he took his own time. He was quite listening, and his register was so low. So he didn't say that. I'm really sorry to hear that, or his voice was very low, right? I'm really sorry to hear that. Or so the register or the tone was quite low. So you need to maintain these the same way as it is. So you need to maintain the same level of tone and register as in the same as of the patient. Okay, so try to remember that and also to empathize.
I'm just tired all the time, and the kids and job, and I just don't feel like managing very well. I can't sleep.
Okay, well, why don't we just look at one of those things at a time? Tell me a bit more about you say how.
Uh, See here again, the doctor is trying to structure her speaking. Okay, the doctor is trying to structure her. Okay, so that he understands it very clearly. So this is how we should be doing. See, for example, if there are a lot of concerns coming up, so you need to listen to the concerns one by one. So you put your involvement. So this is how you initiate the speaking. Otherwise, normally, if the doctor did not had put this in a structure, the whole communication would have been monotonous. For example, the patient would have been kept on speaking further, more. Your interaction wouldn't be there. So basically, you also needs to get interaction. You need to do your interaction. So you need to have a control of the conversation. Okay, rather than having the whole time giving the whole time to the patient. Okay, you can structure yourself, you can put your contributions. You could say, okay, let's look at the problems one by one, and he starts with this conversation. So let's look further.
You say having trouble sleeping.
I just lie awake at night. I don't know what time it is, but it just seems to go on and on and on the night. No, I must have got sleep, but in the morning I just feel so dreadful.
Okay, and are you having problems with your appetite?
Yeah, I make the kids the dinner, but I just can't be bothered. bothered at all about it. Right.
And what about sort of life in general? Have you kind of lost your get up and go?
Sorry, I don't understand.
You get up and go, your energy levels.
Okay, so here is what the doctor says. He's trying to use actually a slang out there. Okay, so this is what a slang is all about. So when you normally speak, basically, there are times when slangs are being used. Okay, even though they are of the same country, different people have different slangs, different parts of the different the people uses different slangs. So get up and go is a slang where one part of the people uses. Okay, but the patient did not understand what he has really meant to say. Okay, so maybe she is not from the same part of the country where the doctor is from. That could be a reason where she could not understand. So try to avoid any sort of slangs while you're speaking. Try to be very, very clear and very simple while you're speaking. Okay, so try to keep up the same. So that is what a slang is all about. Okay, and even if you encounter something like that, okay, even the patient did not understand what you have just said, or she pardons you, you need to make it very simple. Okay, you need to make it very you have to give that information in a very layman's form. Okay, so you need to make it very simple as it is, and at times you have to anticipate yourself when you're trying to give about the medical terms to the patient. You shouldn't do that. Okay, you should try to make it very simple, or medical forms of explaining procedures. Okay, so make it very simple so that the person in front of you can understand it very easily. Okay, so let's look further with the video.
So have you found that they're kind of low?
Yeah, I used to enjoy going swimming with the kids and stuff, but
Uh-huh.
I just want to be on my own. I just can't be bothered. I just...
Okay, I just wanted to pause because the patient is talking, and the doctor, he actually responded. Is actually acknowledging what he or she is saying by just saying mm-hmm, okay, uh-huh. So those um, things needs to be placed when you're speaking. Okay, so rather than sitting simply there or without making any interruptions, that actually is gives an intention or a feeling that you are not quite interested in listening to the person. Okay, so you need to really get involved with the speaking or get involved with the conversation by giving all these postings like mm-hmm, okay, mm-hmm. So at least keep on going, but not too much. Okay, to a limit. So when I say that you should use this, you should not completely say that. Mm-hmm, mm-hmm. Just don't do that. Use it very wisely and see, and to make sure that the other person is listening to you. When you speak in your regional language, when you speak with your colleagues, you normally do that, right? But it does not irritate the other person. The same way, you need to perform that in while you're speaking in English as well. Okay, so let's move on to with the video.
I'm just not being a very good mum at the moment as well, so I'm just so exhausted, really.
Can you, just going back to your sleep, can you tell me a bit more about that? How much sleep are you getting each night?
Okay, so if you see it here, she actually really turned out from the subject she went to because, due to her emotion and her problems, she actually moved, stating that she is not a good mother and she does not want to talk about that and things like that. So she was actually moving out of the topic or the fact that moving out of from the real concern. Okay, so again, what the doctor did is that the doctor was trying to bring back her to the same, to talk about the concern. So that is why he reminded about So let's talk about the sleeping. So that's how he brought her back to the, when emotions are there, definitely people intend to move with the emotions. Okay, so we need to bring them back. We need to bring them back to the track. Okay, so for that you need to be actively listening. You need to pop up the bring in the situation back to your control. Okay, so let's listen further.
I lie awake and just think about him and her together, things that we used to do, and I just wake up exhausted.
Sounds like your lack of energy and lack of sleep and lack of appetite. It seems to me that things seem to be really getting you down.
I'm just such a mess at the moment. I'm just not coping, I'm just exhausted.
You say you're a mess.
Well, look at me. I just need some sleep.
Okay. It would be helpful for me just to sort of find out a bit more about home life and work life and ask a few questions in that area.
Yeah.
Would that be okay?
Okay, coming back to the video. So the doctor actually, when he or she is trying to ask questions with regards to the social background, yes, so it needs to be asked in a very diplomatic way. For example, uh, uh, so you need to tell why you're asking that question, because most of the times people does not like to be questioned with regards to their social background. So you need to be very diplomatic and polite in asking that question, and you need to really state the reason why you're asking. Okay, to uh, to help me determine what exactly the problem is. May I pop up with some questions with regards to your backgrounds or something like that. So you can put it like that. Okay. So this, in that way, when you give that information, the patient will be ready to share the information. So it needs to be very polite and things like that. So there are situations when in role play cards, you need to ask questions about whether the patient is having a smoking habit or not. So what I've seen in many of the candidates is that they straight away ask about, do you have a habit of smoking? Yeah. So I think that is some sort of, a good way of, not a good way of asking questions. Okay. So you can ask the patient in a way that, do you have any sort of habits which you think would contribute towards your disease? Okay, or do you have any particular habits? So it doesn't state that whether it's a good habit or a bad habit. So he or she would say that, okay, this is what I have. Okay, or do you have anything in frequently being done which may inhibit towards your disease? All these things. So you can ask it in a polite way. Okay, so or you can even ask maybe. I do see that you have some sort of breathing problems. Normally, the breathing problems, most of the people who acquire has breathing problems also has smoking habits. By any chance, do you have a smoking habit? So you put it like that. Okay. So you're not stating that what he is doing is wrong, but you're just trying to figure out the right way, or you're trying to figure out the habit from the patient. So not directly stating that, do you have a habit of smoking? Okay, it is okay, but I would really say that you put it in a different way rather than using a different tone. Okay, so let's move with the video.
Okay.
Yeah, it's fine, sorry. Yeah.
So do you work?
I work in a job centre. Gets a bit stressful at times. We've got to see so many people. Of course, they're stressed.
I've got some patients who work in the same environment. It's very high pressure, isn't it?
Yeah. Some mornings I just can't be bothered to get out of bed, and it's that's worrying me because I phone in sick, and you know, it's not good to have a sick record, is it? It's not like me.
And who else is at home with you?
I've got 2 kids.
How old
One's
are they?
one girl, one boy. Well, Richard is the youngest, he's 7. And Marie, she's 9.
Do they get to see their father much?
No, he can't be bothered now. He's got a new family. He doesn't see them at all. They're very good kids.
That must be quite hard on both you and them.
I try and be a good mum, but it is very difficult.
Do you get any help or support from anyone else?
Oh, my mum, she's wonderful, but she has arthritis, and so she, you know, she does what she can.
Does she live locally?
Yeah, she's just round the corner, and she picks the kids up from school, and yeah, she's an angel. She helps me lots.
What about you? What about your hobbies and things you enjoy doing?
I used to enjoy going to the cinema with my friends. Even line dancing, we used to go down to the village hall line dancing. But that's been a while ago. Nobody wants a bit of misery around, do they? And I'd rather be on my own now. Yeah. Thank you.
Well, I know you're not a doctor, but you must have had thoughts about what's causing all these feelings. Had you thought about those type?
Okay, with this point, you could see that the doctor is trying to get the perception of the patient. Okay, this is how you put in a question that what does the patient feel about this particular problem, and what could be the options. So he's trying to get the information from the patient that what she knows and what she thinks could be the problem, okay, and what needs to be done. So he's trying to gather this information so that he could give a very good, proper, remedy to to her problem. Okay.
Those type of things.
I guess I was on automatic pilot when he first left. I guess that's why I'm in the state I am now. I don't know. Could I resent the kids? I don't know, but I suppose that's why I keep going down, and I just feel everything's useless. I can't sleep, you know.
What tends to bother you the most? Is it the sleep, or your appetite, or the energy, or
It's the sleep.
not coping with the kids?
It's the sleep. I just feel if I had a bit more energy, if I could just have something just to, you know, help me out with them so I can do the normal thing.
Okay, here again, the doctor specifically is asking what is her real requirement, because when she stated about her problems, she said she has lack of sleep, she's exhausted, she has a lot of other problems, family issues, and things like that. So the doctor here is prioritizing the concern. So he prioritized from her words that, or her herself made the priority that she has a problem of sleeping. Okay, so the doctor is getting the idea or clues from her speaking that she has a problem of sleeping. Okay, so let's look further then.
Do the normal things.
That was going to be really what I was going to ask next. I mean, what were your thoughts about how he could help you today?
Well, I just thought with I know there's other things, but sleeping tablets, I thought they might help.
Would it be a good idea, perhaps, if we think about all the options and available to you, and then decide which ones may be best for you?
Okay. What are the other options?
Well, you might have heard of some of the
Yes, here again, the patient has only one option in front of her, as per her knowledge. That is, taking in sleeping tablets for her concern about sleeping. But that since that has been understood by the doctor, what doctor says is that he says that there are other options as well. So that is where the patient is eager to get those information. So this is how you need to create some sort of eagerness in the patient, so that you put in certain things, so and ask if he or she would be ready to accept the options which the doctor is planning to give. Okay, so he creates a eagerness there. And again, furthermore, he is also speaking about the disadvantages, or the problems of using sleeping tablets continuously or on a long duration. Okay, so and tries to make the patient understand about the problem, so that she selects the options by herself to the options. So rather than, he does not have to, he only gives the options, but the patient herself selects that option, which one she wants. Okay, so let's look at the video again.
The talking therapies, being able to sit down and talk with a sort of a trained counsellor about your feelings and about what's been happening.
Will that help my sleep? Will that make me be able to cope the next day through sleep?
It may help you deal with some of your feelings. I take on board about the thought about using a sleeping tablet. I think that could be another option. Obviously, one of the concerns we have is that we don't want to have you on sleeping tablets for a long period of time, because there are issues about becoming dependent on them and reliant on them.
Yeah.
But we can use them for a short period of time, say for a week, to help you get back into a bit more of a normal sleep pattern.
Yeah. That sounds good, but
I mean, what about those? The two options. There's the option of the counsellor, or perhaps trying
my
a short
friend, she
course
had
of sleeping.
counselling. She had counselling. I'd like. I mean, I just feel if I had some sleeping tablets, that might just give me a spur, really, and I'm quite happy with the counselling as well.
Okay, so you'd like to try both. I think that sounds a good idea. And would you be happy to see the counsellor here at the surgery?
Yes, that'd be fine.
Okay, so I can organise that. I can speak to her and ask her to contact you to make an appointment.
Okay.
It'd also be really helpful for me as well if you could complete one of our HADS questionnaires.
What's a HADS? What's HADS questionnaire?
Sorry, it's a short questionnaire, just asking some questions about your feelings, and it'll help me to find out if there's any more help I can give you when I next see you. Is that okay?
Yeah. No.
From what you've told me today, I mean, it sounds really, for the last 12 months or so, you've felt really low since you split from your husband.
Yeah.
Your sleep's not been good. Your appetite's not been good.
I'm a mess.
It sounds to me like your self-esteem's taken a real knock, hasn't it?
Okay, with regards to the summary and closure of the speaking, so here what the doctor does is that doctor does not make the patient summarize what has been discussed, because she is in a depressed state. Yes, so it wouldn't be good that to make the patient speak about that again and again and again. It's because she might go with her feelings, so we would not end up in a good within the time. So what the doctor does is that he does the summarizing and what has been discussed during this period of time. Okay, so that is what the doctor does, and he goes with it. So this is what you also should be doing, depending upon the situation and the scenario. You need to decide by yourself whether which is possible. Maybe the who should be summarizing, whether you should summarize or the patient should summarize, depending upon the things. If the patient is not depressed or anything as such, it's just a normal advice. It is better that you could ask the patient to summarize. That would be good. But these situations like these, when the patient is quite upset, depressed, and things like that, it's always good that you do the summarizing so that the patient understands it very clearly, because to avoid any further emotional state or to improve or to to reduce the depression state of the patient. Okay, so let's further look on. We see the
I
completion.
certainly think the help we can give you with some counselling, in which we have a counsellor that comes here in the surgery that I think will be a benefit to you, and then we'll try this short course of sleeping tablets to try and get you back into a sleep pattern.
Okay.
And then maybe I can see you in about 2-3 weeks' time. And I don't want you to think that you have to sort of manage all this by yourself. I mean, that's why we're here. We're here to help and support you further.
Yeah, okay.
Let me do the prescription then.
Thank you.
Okay, towards the end, what the doctor is doing that he gave the options. If you see what the doctor has done is he did not use the same words or sentences. He um, you know he said the same idea, but not hasn't used any words or sentence which he has used earlier. It's completely different. He made it very different. He made it in a different way, and also. What he did is that he also gave the option and also reassured the patient that, in words that he would really support her, or she would help with the support of her life pattern and things like that. So that is what he did. Yes, reassurance also was provided to the patient. Okay, so let's complete the video then.
It's 12 Hadfield Close.
Yes,
is that
it
right?
is, yeah.
Okay, so that's gone to reception now, so you can pick that up on the way out.
Okay.
And if I give you one of the HAD questionnaires as well, you
Okay.
can complete that before we see you next time.
Okay, thank you, Doctor. Thank you for that.
Okay,
Thank
see you next time.
Thank you.
Okay, bye-bye.
Okay, with that, so we are done with the video and the discussion. So, do you have any questions pertaining to this particular discussion which we had with regards to this video, or any questions? Does anybody of you have any sort of questions with regards to the role play or the speaking scenarios and things like that? Okay, so I do see that I think a few questions are going to pop up. So let me just wait for it. Yes, it is good that if you are interrupting, if you need to interrupt the patient, yes, we need to really ask, we need to say sorry and things like that. Yes, see, in a normal ways, we don't use that format or we don't use sorry that often. Okay, but if you go to any of the English speaking country, you walk around the city or you walk around the places, you would see a lot of people being acknowledged or saying, when they walking around, if they just quickly bump into you, they would say sorry and just say it's something like a habit, I think, which most of the English people have developed. However, we don't have that culture into place. We ask sorry when there is a real thing which is really happened. So even if you bump into someone, you normally don't do that. But I would really recommend if you could start, practicing that during your life or during your daily living. So while speaking, also that would help you. Okay, yes, as Vipin, you need to really use the word sorry before interrupting into, or if you're going to stop someone, yes, you need to say sorry and use it. Okay, so you need to first get the permission for that. Okay, okay. Any further questions? I hope none of you have any questions with regards to this. So let us quickly go to the role play card. Uh, Marin, I don't know if no, or maybe I think it's no. Yeah. Okay, so let's quickly go to the today's role play card. Okay. I hope everyone has a clear view of the role play card. Can you all view the role play card? Okay. Okay, so let's quickly go through the setting first. So the setting is a hospital ward. So the patient, you are a nurse at the hospital. Okay, so let's look at the scenario here. This patient was brought into the emergency department of your hospital late last night, suffering from an acute asthma attack. He or she is currently being held for observation. The patient has had a fright and is very concerned about his her condition. Okay, let's look at the tasks one by one. Find out how the patient is feeling and if they have any questions about asthma. Then the second task is explain what asthma is. Example, chronic disease of airways, etc. Then the third one, discuss the causes such as environmental factors and an inherited predisposition. Then explain the treatment, for example, Ventolin, okay, inhaler, and how to use such an inhaler. Okay, the fifth one is discuss the prognosis for asthma patients. Deal and number six, deal with patients' anxiety about problem. Emphasize that asthma can be controlled. Okay, so these are the tasks which you would be going through or you need to do while performing this role play. Okay, so before here, let's quickly see how can you introduce to the patient and how do you start or how do you initiate the conversation. So could you just quickly figure out or could you just formulate a dialogue um, by with greeting, with introduction, and also by initiating, and also how to initiate the speaking. So could you put in some of your ideas? I want all of you to be typing the same because I see only a few of the people are being getting, involved in this. It doesn't matter, you don't have to really think about it. See, if you think that you're going to make mistakes, let's make mistakes, fine. This is a time where you can make mistakes and you learn. So it's better, make some mistakes. It's no problem. Even if you're having some sort of spelling mistakes and things like that while you're typing, if your English sentence construction is incorrect, absolutely fine. Put in your efforts here so that, you can learn. If you don't put in your efforts, you never would learn. If you don't get out of the shyness and the scariness, you can't start learning. So try to put in your comments and your, introductions, the way you can introduce. Okay. So I have Tina here. It says that, good morning, my name is Tina. I'm one of the registered nurses working in this ward, and I'll be looking after you today. How are you? Okay. How are you feeling so far? Okay, that's a very good start. So this is how we initiate the speaking, Tina. That's absolutely good. Okay, so that is absolutely fine. So let's look at some of the other few candidates who would like to share their ideas. Okay, yeah. Good morning. I am Abhijit Raju, registered nurse in the ward. I will be taking care of you today. How are you feeling now? Did you had your breakfast? Okay. Abhijit, what I would really say is that. If you could put that breakfast before how are you feeling now? Okay. So basically, what happens? It's a very long sentence normally. Okay. So it will be quite difficult for a person to figure out the question uh, and answer to that because the last question was, "Did you have your breakfast?" So it is a yes or no question, correct? So it is always better you have that in place, or you get an answer to that breakfast, then how are you feeling now? Okay, so that would be a very good option. So it's better you ask that question first, and you go on with the open-ended questions. Okay, yeah. Okay, Shinu has saying, good morning, Mr. and Mrs. Shinu, a registered nurse here at the emergency. No, you are not in an emergency. Okay, yes, sorry. You are in an emergency. How are you feeling today? Absolutely fine, Shinu. Okay, fine. Shinu, that's really good. Okay, so let's look at Danya. Good morning, I'm Danya Rai. I'm one of the registered nurses in this ward. I'm assigned to take care of you today. Uh, are you, how are you feeling? Okay, that's absolutely good. Okay, fine. Fine, Danya. Yes, absolutely fine. Chinnu Mulvani has written, good morning, I am Chinnu. I will be taking care of you. How are you feeling today? Good, really good. Good morning, I am one of the nurses, okay, working here. How are you feeling today? Absolutely fine. Yes, yes. Okay, so we have, good morning, I am one of the, okay, uh, Marlin, yes. Vipin, hello. Uh, I am one of the registered nurses. What, how are you feeling today? Okay. Um, I think, Vipin, when we put the question, the best thing to do is to put in, how are you feeling now? Okay. So, because the day hasn't completed, no, basically, it could be a possibility that you have gone in the morning. So, uh, be precise is very good. So, we need to know what is the condition now. Okay. So, that is what we want to look at. Okay. I'm Marin, going to take care of you. Okay. Hi, Marin. So, yes, I'm Marin, who's going to take care of you today. How are you feeling now? Okay, that is the right way of putting it. Or, yes, you can even put in like, Hi, my name is Marin. I am one of the registered nurse here. Are you Mr. So and so? Okay, you asked that question, and how are you feeling now? So this is how you put in. Okay, Marin. So Sunita has an approach. Hi, good morning. I am Sunita and one of the registered nurses in the ward. How are you feeling today? So I would really recommend Sunita if you could make it. How are you feeling now? Okay. Good morning. I'm Kavita. I'm a registered nurse. Could you tell me your name for my reference? Okay. How are you feeling today? Did you have a sound sleep last night? That's absolutely good. How are you feeling now? Or see, I would say again, Sunita, Kavita, what I would really suggest is that we could put that. Did you have a sound sleep last night? In the beginning, that would be a good option because again, that would really help you. Okay, and that is a yes or no question. Yes. So did you have a sound sleep last night? So he would say yes or no. So it's better we start with an open-ended question, okay? Or you place the open-ended question in the first, then towards the your closed-ended question in the first and the open-ended question towards the end, okay? Hello, good morning. I am Bhavita, one of the registered nurse. We'll be taking care of you today. How are you feeling? Okay, there are two days now, so that is why I suggested, how are you feeling now? Fine. Okay, good, Bhavita. So, Linu, good morning. My name is Linu, and I'm one of the registered nurse working in this emergency department. How are you feeling now? Absolutely good. Okay, okay. So, I hope we have, you know, quite a few people who have understood how to do the introduction and how to initiate the speaking. Okay, absolutely good. So let's move on to the task. Okay, so you asked a first question: how is he feeling now? Okay, so that is that is the first question to find out whether the patient is still having some sort of difficulty at this point of time. Yes, the patient would say that okay, I'm still having some sort of breathing problem, and so maybe the patient would ask, okay, or you could ask the patient that, do you know what exactly is the problem with you, so that you're having all these difficulty in breathing out there. So you ask a question, so see if the patient is having any sort of idea about it. So how do you place that? Okay, so how do you perform the task of the first one? So you ask the first question about how the patient is feeling, and you need to ask before asking the question. So it states that if they have any questions about asthma, okay. So how are you going to present this particular task? So I would appreciate if you could put in, you know. Within yes. First of all, I want to know: do you have an idea of asthma or disease asthma? So first of all, before you popping up that question, we need to. What if the patient asks you back? Why do you ask so? Okay, so it's better we put in a place in a question as such, whether the patient knows that what is he affected with. Okay, whether he knows he has asthma. Okay, so it is quite good that we ask a question that do you know what is your disease condition? Okay, so if he doesn't know, then we explain and we ask questions like that. So see again, Madeline Mani, when you ask that question, why you here? There could be a possibility of patient asking, saying that yes, I had a difficulty in breathing yesterday, so that is what I was being brought to this hospital. Okay, or I was suffering from an acute asthma. Okay, that is very known. Okay, fine, that's absolutely fine. It is quite that, see, it is very prominent that he is here because he would definitely know that. Okay, So you can ask uh, like this. Do you know what type of disease you're having at this point of time, or what type of disease you're having? So you're just asking whether he knows about it. So what he knows about this, or yes, once you know that he is very sure that he knows he has asthma, then you ask a question. So, do you have any, what do you know about asthma? Or do you have any idea about the disease asthma, as we've been asked? Okay, so we can put forward questions like that. Then we can start connecting with the condition. Yes, absolutely, Lino. Yes, you can put in, do you know what is the condition you have? Okay, so absolutely good. You can place them. Before going further, can I ask you some questions? Are you aware about the? Are you aware that you have asthma, Merlin? Let's see. When you say that, actually, I feel that we are trying to scare the patient. Okay. Um, uh, you need to, as we said, you ask the question and try to get the answer from the patient. So that would be really good. Okay. So it's better that we ask the patient, we get the answer from the patient, that is asthma. Or if he says he doesn't know that, okay, you can say that, okay, um, uh, from the diagnosis we understand that you are having this asthma disease, okay, or you are having asthma. So do you know anything about asthma? Okay, are you aware that you have asthma would be a question where the patient thinks this is something very big disease. So we are actually trying to scare them. Okay, so try to make it very simple. So that would help you. Okay, okay. So further, I would like to ask before for okay, Tina has this thing that before proceeding further, I would like to know whether regarding your knowledge about your medical condition. Yeah, that's a good option, Tina. That is a very good way of presenting it. Okay, Shenu, are you aware of what happened to you last night? Yes, that is another way of framing questions and getting things out of it. Okay. Do you have any idea about your condition? So, Bhavit, I think that would be, if you could reinstate that question, would be a great idea. Because if you have any idea about your condition, uh, because if you put a stress on that, that would really, really change the speaking or the understanding of the patient. Do you have any idea about your condition? So you, what if, as if like you're asking, he does not know anything about what is happening. Okay, so it is better that you may ask, do you know why you've been admitted here in the hospital? So that would be a proper, question about it. So basically, like, do you know why you have been admitted here at the hospital? So that would be a proper way of asking. Okay. So, Sonia Matthew is saying that I think doctor has well explained you about your condition that you're diagnosed as asthma. Do you like to know anything about the medical condition? Sonia, I think we need to, what do you need to, the first sentence is absolutely right. You are done very good. But I would really say that the second one, do you like to know anything about the medical condition? So you need to ask him, you need to first the criteria. So let's look at the criteria as it. So we need to first find out whether what the patient knows about this particular condition. Okay, so then we explain it, right? So we need to ask, do you know anything about asthma, or do you know about asthma? Do you know about asthma? So you ask a question like that, okay? So that would be more good. Okay. Onyamati, shall I explain to you? Yes, if he says no, yes, shall I explain to you? Good. Fine, sir. Okay. So any further type of questions? Do you have any questions with regards to this particular task, that particular, things? Does anybody has any sort of questions? Okay, so I believe that nobody has any sort of questions. Okay, with that question, we try to, combine with or we try to link questions, and we try to combine the task and go with it. Okay, so we're trying to connect it. So we asked about whether the patient is aware about what he knows about asthma. So you explain. If he says that he does not, you explain about the condition. Okay, so people who does not know much things about asthma, yeah, we do have an example here stating that, okay, asthma is a chronic disease of airways. So you can, you don't have to explain in detail. Make it very precise. Say that it's a chronic disease of the airways, which causes hindrance to your breathing. Okay, so make it very simple and put it in a very simple layman form, okay, layman language, so that the person understands it. Don't try to use any sort of medical terms into your speaking. So, if you use that, it would be quite difficult for the patient to understand all these things. Okay, Mm. So. After that, we will go with the third task. So, how are you going to, um, you know, perform this task? So, how do you frame questions, or how do you go about this particular task? So, could you frame some dialogues with regards to that, so we could discuss about it? Sonia Matthew has said, "Shall I explain to you about the treatment?" Um, Okay, are you asking me a question, or are you, popping up? Sonia, are you asking me a question about whether you want to go to uh, the the fourth one? Uh, yes. Then yeah, what you have said, what you have popped up the question. Yes. Can I ask you something regarding the type of job you do? Yes, you can. You can. Yes, you can do with it, and how to use it. Um I think we have another task in front of us, Sonia. So it's better that we cover that and go. Okay. So, like, discuss the causes. What would be the causes? So we need to explain him so that he could avoid, all these causes when he gets discharged from the hospital. Yes. So it is better that we give those information to the patient. Okay. So you can just ask, do you whether the patient knows about the causes of his this particular disease. Does he has any sort of idea about the causes why he has got this particular disease. Okay. So that would be a good question if you put place. And how to use it? No, sir. Okay, asking permission to the patient. Yes, you can ask permission. You need to ask permission with regards to it. Yes. Kavita, I think that question which you have, could you tell me, do you have any other health issues? Here, if you ask that question, actually, we are trying to deviate from the real problem, because we have brought the patient into that particular state where he said that he has asthma, or he knows about asthma. So, what if he says that he has arthritis? So basically, then we have to talk about that as well, right? So it's better we stick on with it. So we ask him very clearly about, or we focus the answer into, or we leave that answer into something related to his breathing problem. Okay. So, Kavita, I think you need to actually concentrate towards that particular. So, see, let me also tell you all that I'm not asking you, I'm not pointing out your mistakes. I'm just making corrections so the other person or the other people also could, don't take it very bad. Okay, I'm not trying to point out on each person. So, it is good that, you come up with these questions so we could avoid, everyone could avoid these type of. I would say that rather than having the right answers, the wrong answers would be quite good. So that we could discuss about it. Yeah. So we could avoid further things. Okay. So I think Kavita, you understood what I've meant. I meant. Okay. So Madeline says, is there any allergy what triggers asthma? Okay. So that is that a good question, Merlin. Merlin Money. So I think we need to is to do that. We need to ask him. So that if the patient has any sort of idea what has caused him this disease. Okay. If he says no, then you can say that. See, some of the causes for asthma is environmental factors and inherited predispositions. For example, you could ask, okay, we would go one by one. So we would first see at the environmental factors, and you say that where do you may I ask you some questions pertaining to this. So you ask questions about where do you work, do you get involved with dust or any sort of dust particles. Okay, what type of job you are into? Does your job demand any sort of inhaling of dust particles or environmental factors? So you can connect and ask questions like these. And also, if he says no, 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 and all these things, you say that okay. You don't say directly that okay, this is the problem. No, so this might be the cause of the asthma. Okay, so you say like that. So you say that you don't say that this is the cause of the asthma. You say that this might be one of the causes of the asthma which you're going through at present. And you can also say he says he's not allergic to any dust or anything as such. So you can ask a question. So any of your family members has any sort of breathing problems or asthma? So if he says yes, yes. So this could be a possibility of you inheriting the asthmatic problem. So this is how you put forward. Okay. So I hope you have understood, Merlin. Okay. Pinel, so can you memorize what you was doing when you got a sudden breathing difficulty? Um, yes, Pinel, that is really good. Or okay, or you can even state that could you try to recollect what caused you this difficulty during, okay? So that is absolutely good. So that is a good way of getting the answer or getting the right way. And again, what you're going to do is like you're not going to straight away confirm that this is a cause. Okay, you're just saying that this could be a triggering factor or this might be a cause. Okay. Yes, you can definitely ask Danya. Is the job you do is exposed to pollution and things like that? Yes. Sonia Madhu, could you please tell me that? Do you have any family history of asthma? Yes. You may ask any family history of asthma or any sort of respiratory problems. Okay, breathing problems. Okay. Asthma can develop either environmental or hereditary. Can I ask you about some questions regarding that? Absolutely fine, Vibin. So you can definitely go with that. Okay. Marlin, yes. Do you know how it occurs? Um, yes, it is absolutely fine, Kavita George. It's okay. Do you know how it occurs? Okay. Tina Stephen, do you know the fact? Do you know the factors which triggers your medical condition? Um, See, we can't really put that into place, Tina, because unless and until we get what he is going through. For example, what if you say that the environmental factors, the dust, uh, what you can say is that let's look at some of the factors may trigger your medical condition. Okay, so you can put that as a question and you can pop up because we never know that if the patient is having some sort of dust allergy. What if the patient does not have any dust allergy and still he has asthma? Okay, so maybe the cold condition, yeah, due to the climatic change that could cause. So we never know about it. So we can say that maybe some of the factors. Okay, so you don't say that. Do you know the factors which triggers your medical condition? Yes, you can ask that question, but it is always better. What do you think maybe have triggered your medical condition? Okay, because the patient is also not sure. See, if the patient was quite sure about it, he definitely would have avoided it, right? So what he thinks might have, okay, that could be a good question. Living comments, could you explain to me your living status, like your job or place of living, so I can help you with some remedies that would control your problems. Straight away going into that, it's better we first analyze about you tell him some of the these are the factors, identifying the factor where he is. Okay, so maybe you put in a question like this about the environmental factors. Do you know, is there any environmental factors you think might have triggered your condition? Or do you have any sort of inherited predisposition of asthma or from your family members or anything else such? Then you can, cause. So these are the factors which would trigger basically like the dust, the cold condition, the climatic condition, and also a secondary where things could happen. So you need to basically put that into first, then to these questions. I think you will understand. Do you have any pets in your home? Yes. See, these questions when you apply, you need to if you're not getting to that particular point, yes, that is when you can if the patient says no all your questions, then you need to dig out. Yes, you need to ask all these questions. So when you put all these questions, do you have any pets in your house and all these things? Okay, uh, try to ask the questions in general, uh, okay, so that you could get the answer very easily, so that you can directly go into the remedies and things like that. Okay. Okay, so I hope with that we have discussed about the third, um, the portion, that is the third task. So I hope till here everybody is very clear about how you need to do the speaking. Yeah, is that clear? So if that so, then we can move on to the fourth, fifth, and sixth tasks. Okay, if you have any doubts, please feel free to ask. Okay, so I'm here to answer your questions as much as I can. Okay, so moving on to the treatment plan. Yes, here is where we bring in the structure. So could you tell me how are you going to put your statements or your dialogues? Okay, maybe you can try to combine all the three, uh, you know, um, um, three tasks together and form a structure so that you can, uh, inform the patient so that you illustrate that you are going to do this. Okay. Sonia, I would say that before you pop in that question, have you tried to use inhaler ever before? So you need to ask about if he is taking any sort of treatment or any sort of medication. Okay, so if he says no, then you can have, because straight away don't introduce an inhaler into the kind. So it's better we ask a question like this. Um, are you in of any sort of treatment, or are you taking any sort of medication for your asthma? Okay, so you ask a question, so he himself, the patient himself, would deliver. Okay, so you ask that question, then you are going to introduce about the treatment. So there you need to provide a structure to the patient. So you're going to say that, okay, right now I would discuss about the tell the patient that, okay, so I do see that you having using this medicine and inhaler, or he would say that no, I'm not using any sort of inhaler. So you could say that right now I'd be discussing you with the treatment plans and the medication and the usage of how to use the medication, and the advantages and the usage of all these things, and also to avoid any sort of problems. So you need to form a structure, okay, uh, and you need to show that what are you going to discuss, okay. So you need to basically form a structure towards the patient, or you need to demonstrate. Biji is having, are you having any medication? Okay, so have you used the inhaler before? Yes, that is good. You prompt a question, you get to know whether he has ever used this, or then you tell that. Okay. Okay, Dania says, let's discuss the ways of treatment available for explaining using of an inhaler. Okay, fine, fine. Yes, yes. Ania, I wouldn't say that that question would be adequate out here. Are you aware about the treatment modalities of asthma? Um, I think the best question is to ask whether he has been under any sort of treatment, or he's been taking any sort of medicines or medications. Okay, so then we can subscribe. Okay, since it has been turned as acute, we need to provide blah 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 blah. You can say all these points. Okay. So while explaining the cause, do we have to first ask them what do they think might be the cause, and then explain them about the various factors, or the vice versa? Shinu, the thing is that, see, what does the task state? Discuss the causes. Yes. So you can ask a question, to bring the patient, or to get the answers very clearly, rather than you probing the questions. It's basically you're trying to probe the patient to get towards the answers. Okay, so rather than you just putting in the question, does not it will take more time. So basically you have only 5 minutes to do your speaking, so you need to use your time very effectively, for which what you have to do is you need to initiate questions to ask about the causes. For example, do you know what might have triggered your condition? Okay, what might have triggered you to this condition? Okay, so maybe then he or she would give you the options. Okay, clear? Okay, Tina has, don't worry, we are here to help you with the advanced technology, and your condition is well treatable. Are you taking any kind of medication or inhalers? That was good. That's good. Yes. Bobby, have you used any medication for asthma? Okay, let's explain about the inhaler. Okay, that is good. Okay, Marin says, let me explain the treatment of asthma. First of all, it's not curable. Don't give the bad news at all. Okay. Um, the first thing is don't give at this point of time. I think better you're just starting to explain it. Yes, so give the medication. Then you would say that even though the medication is quite useful in occasions of the treatment in asthma, but it's not completely curable. But it could be controlled using the above medication. Okay, so Marin, when you say so, don't put in the. You have to put it in a very good manner. Don't first of all say that it is not curable. So basically, the patient gets. Then what's the use of doing the treatment? The patient could ask you a question. So it's always better. You the way of presenting things needs to be in a very good manner. Okay, we should not panic the patient. Okay, now let me explain the treatment of asthma, and you could say that. Um, I could, you are prescribed with an inhaler, Ventolin, and I could explain you about the usage or how to use the inhaler. Would you be interested in listening to it, or would you like to hear this? He would say yes. Okay, so you explain it, but after you explain that, you could say that you would be able to improve your breathing. However, um, this would not completely cure you, but this would help you to improve your breathing. Okay. Okay. Apologies for the disconnection. I think, can you all hear me? Are you able to view me as well? Okay. Okay. So yes, yes. Okay. Okay, fine. I got it. Okay, when you say the can I demonstrate? Basically, you have to show that. Yes, so we don't. You don't use if you don't. If you're not an asthmatic patient, you don't demonstrate that. Clear? Okay. It's a medicine. You cannot. You don't demonstrate it. Okay. You can show the procedure, or you can just show that, or okay. So that is what you should do. Yeah, Biji. Bridgie, are you clear about it? So when you use the word demonstrate, it would be you have to physically show that. So it is not a good way of saying that because you might not be an asthmatic patient. So how can you demonstrate that? Okay. So what sort of treatment you are taking for asthma? Can we discuss about inhaler? Okay, fine. Yeah, that is fine, Mami. Okay, so I hope you're clear about the treatment plan, the Ventolin thing. Do you have any sort of doubt? Okay. So the next one is discuss the prognosis for asthma patients. Yes. So see, we need to basically discuss about the you are actually connecting with it. So that is why I said you should say that it is curable. It is not curable, but however, it can be treated. So that is the prognosis. There is no cure until and unless. So that is what we are going to discuss about the prognosis of asthma patients. Okay. Then deal with the patient's anxiety about the problem, emphasizing that asthma can be controlled Yeah, the patient would definitely have some sort of concern whether he would have to go through the whole thing and all again and again. You need to reassure the patient. So how do you reassure the patient? So can you put some statements in the comment or the chat for how to use reassurance? Can you do that? We just okay. So people who are there, would you like to put some comments on the last one, that is the reassurance part of towards the patient? So in this particular scenario, yes, the first and the most focus is towards the end. You're not going to summarize on what he or she is going to do. You're going to reassure the patient about his anxiety about the condition. Yeah. Okay, I will show that if you take the precautions like not exposure to not exposing to dextro pollen, you can reduce the incidence of asthma. Apart from that, please follow the medications properly, then you will feel better. I wish you a speedy recovery. Tina, what I would really say is that rather than see, most of the times, most of the candidates use the word reassurance. So basically, when you say reassurance, it's all about mm, you don't have to use that word. You can definitely state that there is nothing to worry about. These are the conditions nowadays. It is quite common with most of the people. Okay, so all these conditions could be treated in and by treated with medications, and also by taking certain precautions, you would be able to avoid any incidents of asthma. So this is how you could put in forward, okay. So rather than using the word reassurance, use these type of long sentences so that the patient is more of you know comfortable with your reassurance part. Okay, do not worry about this. This is where this about this. We are here to help you out. Asthma can be controlled as far as we take proper precautions and stick onto your medicines as well as the inhaler. Absolutely good. But also, if you could put in Danya about the comment about nowadays it is quite common with most of the people having asthma. Most of the people, having asthma, or what you have seen is that there have been a lot of people coming in with asthma disease. So there is nothing to worry about if you follow if you take the precautions and also the medications on time. Okay. Asthma can be controlled if you follow a healthy lifestyle and take certain precautions, take medications. Yes, absolutely fine, Richie. So these are the, okay, Vipin says asthma can be well controlled with medication and avoid to exposure. And, okay, avoiding to exposure to the casualty agents, dosages. Okay, try to make it very simple with so rather than complicating using the high-end words. It's better we use very simple words and okay, the response of the body in a long run. Okay, okay. What you can say, Vipin, is that you can always state that control with medications. Considering the exposure, I would really recommend if you consider yourself towards the exposure of dust and things like that, you would be able to control asthma to an extent. Okay, so there is nothing to worry about. So this is how you explain. So okay, Mr. You don't worry about your condition. It's quite common nowadays for all age groups. So you must avoid the factors which triggers to you and continue the medication and follow up. Everything will be fine. That's absolutely good, Lina. So this is one of the way you could explain. Okay, Marin, you no need overly concerned about that, Mr. Can be controlled by using inhaler, advice, manner at correct time. In addition, you have to avoid exposing to triggering factors such as dust, smoke, and so on. If your condition is still persisting, you may come to the emergency where we are here to help you out. Okay, absolutely fine. So basically, what you can say, Marin, is that try to not to give that things would happen. Try to keep him focused on the good part. Okay, so that is good. So say by stating like this is quite common, so you don't have to worry. So that is what people are quite happy when the other person is also having the same sort of disease. Yes, so as we all feel that okay, see when if you're having a problem and the same problem is being affected by is affected to your friend as well, you feel happy, right? The same psychiatric approach is being applied here as well. Okay, so when you say that other people also have the same problem, he is also happy. So this is what we do. Okay, well, and here is basically you're not going to because there is nothing too much to summarize on this. So you just since still the patient is in the ward, so what you can say is that you can state like this. If you have any sort of difficulty, please feel free to ring the bell, and I would be at your doorstep. Okay, so this is how you could end this conversation, and which it could be within the prescribed time of 5 minutes. So you shouldn't explain too much. You should, especially the usage of inhaler and things like that. The procedure should be very simple. Okay, the inhaling procedure should be like you take the inhaler, put it onto the mouth, press that, and inhale it. That's it. That's it. So one by one procedure. You don't have to open the case. Put the the medicine into the inhaler or into this thing. You don't have to explain all these things. Okay. Okay. Is it okay? Say that father had also the same kind of disease. Absolutely fine. See, you're trying to confront with the situation. You're trying to make the patient as comfortable as it is. So absolutely fine. No problems in that. Okay. Yeah. Do you have any further questions towards this particular speaking? So please ask questions if you do have any. Anybody has any sort of questions? Clear. Okay. No. Okay. Okay, so I hope everybody was clear about the session, and as I said, I hope you all had benefited from this particular speaking session. Okay, I will hope so. And with that, we would be ending our speaking sessions and the webinars, and we would be coming up with the new modules, the other modules, webinar sessions of other modules, and you would be intimated through mail by evening about the next day's class. Okay, so if you do have any sort of suggestions or comments or anything as such, please feel free to put in so that myself can improvise on my training skills as well, and also to adapt the best way to tell you things and to which could benefit you for your OET speaking. Okay, if you do have any comments or anything as such, please put on to the IRS group comments, and please do comment on that. Okay, so with that, we are going to end for the day. Okay, you all have a wonderful day ahead. Please keep practicing with the scenarios in your mind. Okay, keep that in your mind, and please practice much more. And I wish you all the best in your OET exams. Okay, have a good day. Thank you.